Okay, I think she has started the recording. Okay.
Great.
So we have hospitals joining across India, and we have a huge number of people sitting in these colleges listening to the whole lecture. And I hope it's going to be really great. So thank
Good.
you. And we'll start in 2 minutes. Thank you.
Lovely. Thank you.
Eva and Indu, how are you?
Very good evening, sir.
Good evening. Good evening. Has Lalu joined? Not. No.
No, not yet. Not yet.
Okay. So I think it is another 1 minute, then you can start the anthem.
Hi, sir. Good evening.
A new horizon of healthcare delivery and patient safety. We have a goal, a noble drive. Hand in hand, step by step, we will thrive to march ahead together for a bright and shiny future with patient safety and quality health care. We are CAHO, your healthcare companion. Standing right by your side. Joining hands for building a vision, shaping a culture for patient safety. Setting up standards with best foot forward. Won't ever leave no stone unturned. We wear our pride on our sleeves. Work with passion like a breeze. Train people, enhancing their skills. Spreading the message of quality health care for safer patient care. A better nation. We have a goal, a noble drive. Hand in hand, step by step, we will thrive to march ahead together for a bright and shiny future with patient safety and quality health care. We are CAHO, your healthcare companion, standing right by your side.
So, good morning, good afternoon, good evening, friends, depending on which part of the world you are joining us from. We are extremely proud and happy to welcome you to this next episode of our CAHO-ISQua International Webinar, and which happens to be the 50th webinar, and on a very important topic on communicating effectively with patients and families. And to introduce our international speaker, I think we are really proud and privilege to have Dr. Indu Arneja, who is our own rock star in the field of communication, especially clinical communication. He is the founder and director of the Indian Institute of Healthcare Communication. I think a lot of people, of course, who are joining from India are absolutely aware about her. He is absolutely a phenomenal person who has taken this whole aspects of clinical communication to a very different level. And we are extremely proud of her being associated with CAHO. Her journey started with it, and now she is also a very active partner with CAHO. So uh, if I start talking about Indu, I can tell you I will not have time left for Eva to be introduced. So I hand over to Dr. Indu Arneja to please introduce our brilliant speaker for today, Ms. Eva Doherty. Over to you, Indu.
Thank you so much, sir. Thank you for the opportunity to moderate this webinar on behalf of CAHO and ISQua, and the topic which is very, very close to my heart, that is communicating with the patient and their family member. It's my proud privilege, friends, to introduce Professor Eva Doherty. I was looking at her CV, and I mean, she has excellent credits to her card. So let me introduce her. She's a practicing chartered. Give me 1 second to. Yeah. So Professor Eva is a practicing chartered clinical psychologist. Very nice to know that, I mean, people in other countries. So Eva, even I'm a psychologist, so it gives me a proud privilege to see you doing the same job in an excellent manner. So friends, she's associate professor and director of the Human Factors in Patient Safety Training Research and Assessment Programs at the National Surgical Training Center, Department of Surgical Affairs, RCSI, University of Medicine and Health Sciences, Dublin, Ireland. So she's pioneered and directs the academic postgraduate diploma and MSc in human factors in patient safety, which is an interprofessional 1 year and 2 year part-time online program. She has over 45 peer-reviewed publications on topics relevant to clinical communication issues, curriculum development, and personality factors in medical education and assessment. So Eva acts as an advisor to the National Healthcare Communication Program in Ireland, HSE. She's a member of the ISQua expert panel and the Independent National Patient Safety Council in the Department of Health. In recognition of her contribution to medical education and to communication training in healthcare, Eva has been awarded a principal fellowship by the Higher Education Academy in the UK and an honorary fellowship by EACH International, the International Association for Communication in Healthcare. So I am very happy to introduce her to all of you, and I'm just looking forward to listening to her talk and the wonderful opportunity to interact with you. Thank you, Eva, for joining us as a speaker. Thank you.
Thank you so much for such a wonderful introduction, and I am really honored to be here with you this evening. And I will just get rid of that there, and I hope now that everything is working. Please let me know. Oh dear, sorry, I have to go back a couple of slides. Now. Sorry, we were practicing earlier on and we didn't go back to the right place. So you're seeing my slides in reverse. Okay, here we go. Let me know if there's any problems with any of this. And as I say, I'm really, really delighted to be here with everybody today. And I really do hope that you benefit from this webinar. That's our latest, newest building in Dublin, in Ireland. That's where we do all our training. We have a 3-floor simulation center where a lot of this training goes on, and I'll show you some photos about that. And just to kind of put it in context and to give you an idea, in the college, the Royal College of Surgeons in Ireland, which is now a university, we have been running a mandatory postgraduate training for surgeons, emergency medicine doctors, ophthalmologists, radiologists, radiation oncologists, and also all our international programs and fellowships. And we collaborate with the College of Anesthesiologists in Dublin, and we also run a program with CAHO-ISQua, which is the College of Surgeons in Eastern and Southern Africa. So we have quite a wide remit there. And our key features, I suppose, is that we have developed outcome competencies for all of our training, and communication is a big part of that. And you can see the titles there of what our program covers. We assess the communication and negotiation skills of our postgraduate doctors at the end of their first year and their second year. And these are very, very high stakes. And it does help to set the bar and emphasize how important these skills are for our doctors. Each trainee comes for approximately 18 courses over the 8 years of training, and we also run programs for doctors who are currently not on training programs, and also for our consultants. So that's just to give you a little idea. Here's a few photographs of us in action, and we have classroom-based training. We have a lot of small group work. That's some of our small rooms there, with small group work going on. We run all our assessments in those small rooms as well. This is our simulated mock operating theatre, where a lot of our team working training and communication training happens. And if any of you are interested, you can check out our online postgrad diploma, masters. We've a lot of international scholars on this program, and if you'd like to know more about it. And finally, we have a podcast series, which we just launched last 2 years ago, and we're into our second series now, and that's everything to do with patient safety. So what I'd really like to achieve with you today is to describe the key skills of effective communication in healthcare. It might surprise some of you to hear that, the best frameworks, the best researchers and trainers in this area. So we use a framework called Calgary Cambridge that may be familiar to you. And they've identified 72 key communication skills. Well, you'd be glad to know I'm not going to talk about 72 skills. I'm just going to talk about some of the key skills that I think makes all the difference. And then to talk to you about how do you use these key skills when you're having the difficult conversations, because I think that's what people are most concerned with. And I think to do this, it's very important to appreciate emotions and the emotional impact on a person, whether it be a patient or a family member. And I'm going to say a little bit about that. And I'm going to finish off then with saying a bit about the use of empathy skills for the difficult conversations, because I think that's what makes all the difference. So in case any of you are not convinced about the importance of communication, this is the best meta-analysis of randomized controlled trials that I like to show people, because it is probably the highest level of evidence that we have that the patient-clinician relationship predicts healthcare outcomes. So on the table there on your left, you can read yourself the actual outcomes that were looked at. And it's quite impressive to be able to see that it is the patient-clinician relationship that determines reductions in pain, in giving up smoking, in controlling your sugar, in your feelings of anxiety if you have cancer, etc., etc. And what astounds me the most is if you look here at the forest diagram up there on the top right-hand side, you will see the biggest effect size. So this is a plot of effect sizes. So all these ones on the right were significant. And this last one here, which never ceases to amaze me is actually with patients with obesity issues. And isn't it amazing, all the drugs that are out there now for the control of weight. And here we go, it's the patient-clinician relationship that most determines that. Here's one I just found this morning that I just popped in because I thought it's quite recent. It's just published in September last year, and I thought you might be interested in it because it's closer to your part of of where you all are in Bangladesh, clearly showing very strong relationships between the patient's ratings of the quality of the relationship and lots of different outcomes, in particular their satisfaction. You'll also be very pleased to know that we've got a lot of good evidence now to indicate that learning how to communicate expertly makes your job satisfaction, your own sense of your job satisfaction improve and decreases your feelings of burnout. And I think that again is counterintuitive because a lot of people think that if they are burnt out, that they just don't have the energy to communicate effectively. Well, actually, no, it turns out that if you do use expert communication skills, you will experience a decrease in your burnout levels. And again, this is all very high level evidence published in really big journals. Okay, if I had you all in a small group and if we were able to have some interaction, and if I asked you what your difficult conversations are, I think you would probably tell me things like this. You would tell me how hard it is to cancel people's appointments or their surgery. You would tell me how hard it is to be able to have conversations with patients who are very anxious, very emotional, very angry. You would tell me that angry family members are really challenging, breaking bad news, having conversations on the telephone, having video conversations. These are all the ones where our skills are really called for to get good outcomes, I think. So when we are having a difficult conversation, ask yourselves this question. What do you think is more critical? Is it the information that you're giving, which obviously is important, or is it how you transmit that information? Well, clearly this is a talk about communication, and you all are probably going to figure out that the right answer to that question is how. And it turns out that there is some evidence on this, and this might surprise you. But in terms of the skills that we use in transmitting what we mean are so much more dependent on our nonverbal skills, so our body language and our tone of voice, than the words that we use. And if you think of it, this can be surprising. However, isn't that the reason why we all use little emojis in our texting and our messaging? Because we are aware that words in themselves do not convey meaning and are very open to be misunderstood. So our tone of voice is crucial, our body language is crucial, and they are so important not to forget. If you think about it, if somebody says to you, take a seat there, versus take a seat there, it's a completely different meaning. So it's very important to always be mindful of our body language and our tone of voice, as well as the words we use. And I think, since the pandemic, and I'm sure in a lot of places where you're all working, you're still having to wear masks. And that means you have to be very conscious of your nonverbal, your eyes, the tone of voice you use, the body language, your gestures be so crucial when you're wearing a mask. Very interesting study carried out in the US, showing that whereas patients loved this idea of transparent masks, the surgeons themselves hated them, but it did improve the detection of meaning for patients. So I think it's important for us when we use whatever kind of mask that we think about our tone of voice. The idea of resonating is really important. We need to speak slower. We need to use shorter phrases. Okay, I'm going to show you a video now for about 3 minutes because I think a lot of people think that they don't have time to pay attention to good communication. And this is a video that was made in the UK that I use a lot. It is an emergency medicine consultant. She's meeting a patient with chest pain for the first time. And we can, here in Dublin, when we use this video, we can pick out at least 10 or 11 really good communication skills that she is using only in the first 3 minutes. So have a look, everybody, and see, can you identify them?
Morning, Mr. Mead.
Hello, Doctor.
I'm Dr. Robinson. Sorry you've had to come to hospital. And I gather you've had to wait a little bit as well.
Well, that's all right. Your staff are very efficient, I must say.
Yeah. How can we help you today?
Well, my palpitations, well, that's what I call them anyway. They haven't stopped yet. They've been going on for just about 4 hours now. And my wife said to me, she said, look, I'm going to get you in the car, she said, and I'm going to get you off the hospital so a doctor can actually see them while they are actually happening to you.
She's worried about you.
Yes, she is.
So you've had some palpitations, going on for 4 hours today.
Yes.
Anything else?
Well, they're sort of, you know, they have been sort of a bit of a problem, you know. Yes.
In terms,
a bit of a problem. Yes.
do you mean in
Well,
terms
they're
of
so
time?
fast, you see.
Oh, right. They're
Really
going
sort
very
of
fast.
Yes,
Okay.
and I do feel a bit funny, I have to say.
What do you mean by funny?
Well, sort of like strained, sort of like tense. And, that's most unlike me, you know. I'm usually sort of horizontal. You know.
They make you feel anxious?
Yeah, yes.
Right. Okay, so you've had this fast fluttering of your heart or fast heart rate
Yes.
for about 4 hours.
Yes.
You feel anxious or a little odd with it.
Yes.
Anything else at all? Have you noticed any other symptoms that you wouldn't normally be experiencing?
Well, yes, I must say I've had this sort of tightness across me on my chest.
Right.
Not a pain, more of a tightness across here.
Anything else?
No, not really, no.
No?
Just annoying, you know.
And have you felt any shortness of breath with?
Yes, I have been a bit short of breath.
Have you been able to do what you would normally like to do, or have you had to rest?
Well, the shortness of breath had really been sort of, you know, for this last 4 or 5 hours, really.
Right.
Before that, I was quite all right.
You were fine, okay. And what were you doing 4 hours ago when all this started?
Well, my wife and I don't get a lot of time together, you know, because we're in business together, you see, and it's the only time we sort of have to relax, really. So we had an early lunch and put the telly on, and then it just suddenly came on.
Right, so you were sitting down after lunch, and then it came out of the blue.
Yes,
Okay.
it did.
What I'd like to do now is perhaps go over the story a little more, perhaps find out if you've had anything similar before,
All right.
and then ask you some specific questions about some other things that sometimes patients feel along with the palpitations and the chest pain, if that's all right.
Okay, yes.
So you've had it.
Okay, we're going to stop there because she's going to go into a more traditional history now. And so that's about 3 minutes. So let's have a think about the kinds of skills she used there. And this, if you like, is our recipe for a good conversation. So first of all, she got the introduction right. She gave him her name. We see in our country a lot of our doctors, especially our junior doctors, give their first name only. Whereas we tell them that patients want to know the doctor's full name, and then you can agree a shorter version if that's appropriate. So the introduction is really important. Social psychologists tell us that it's milliseconds when people decide if they like somebody or not. So it's really important to get that right. The second thing she did was, you know, she asked the patient for what we call the starting point, his starting point, and she didn't interrupt him. Unfortunately, the literature tells us that, and it's mostly been done with doctors, but doctors tend to interrupt their patients and also their families. After, it used to be about 20 seconds, and unfortunately now it's getting worse. It's gone down to 11 seconds. And that's often, I think, because of an anxiety that if you don't stop the patient, that they're going to talk forever. But in fact, if you do let them speak, the vast majority of patients stop talking after 90 seconds. So that's a minute and a half. And very often what you find is you get so much information in that minute and a half that it actually saves you time. And there's lots of questions you don't need to ask anymore. She very quickly came in with empathy skills and apologizing. She apologized for him having to wait. That lets the patient know that, she's on his side. She understands things from his perspective. She was very clever in her use of empathy. She started off identifying that it was his wife who was anxious. And then she eventually then was able to empathize with him that his pain was making him anxious. And she used the word, we often see doctors who do not say out loud the emotion that they can observe. We'll say a bit more about that. She was very clever in her use of open and closed questioning. So she said, tell me more. She kept doing what we call screening questions. What else? What else? These are really good skills to use to build rapport. They're the screening questions. She did something else that you might have spotted, which is called signposting. And that is where the doctor tells the patient why they are asking what they're asking, why they are moving along through the different stages of the conversation. And it brings your patient or your family along with you so that they understand then why you are saying what you're saying at the end. Her nonverbal was really lovely. Now, she didn't sit down, and whereas we do know patients will think that you gave them twice the time you gave them if you sit down, but it might have been a bit silly with that bed because it was a bit high up. But her posture was lovely, it was very open, and she was turned towards him. She had very good eye contact. She didn't use any jargon, her language was simple. And she summarized all along the way. And this is a really good skill to use to let your patient or your family know that you've heard what they're saying, that you're getting the message. A really good rapport building skill, and also checks for understanding all the time. And finally, she did what we call a teach back, and it's also important to do safety netting, which I think she will do at the end. But teach back is the phrase we use for getting the patient to say or the family to say back what their understanding of what has just been discussed. And it's too long of to let you see the whole video, but she does that at the end. But it's just a really important skill to use. So signposting is, I'm calling to give you your test results. I'm going to explain how this procedure will be done. And it comes into extreme importance when you're breaking bad news or you're having to disclose something that's gone wrong, where you give what we call a warning shot. I'm afraid I have some information for you that you may not be expecting. And it's very important to do that always when you're going to say something difficult so that the person can get themselves ready to hear. And sometimes people might say, oh, look, don't tell me now. I want my husband to be with me, or I want my family to be with me. And then summarizing and teach back, of course, is this idea of chunking and checking, not giving too much information in the one go, always checking for understanding, summarizing. Okay, I'm going to go through the main points again. And then teach back is, can you tell me what you understand from what I've explained so far? So I want to say something about empathy because in my experience, I really think that if people show empathy, you can literally move mountains. You can just change the course of a conversation so much. So it is the art of demonstrating that you get the emotion behind what is being expressed. It's not enough to just appreciate it yourselves in your head. It's really important to say it out loud. Patients and families, they need to hear that you get it, that you understand, you can see and it isn't about saying, I understand what you're going through, because very few of us have gone through what the patient and the family are going through. But it is about saying what you can see, or if you're on the phone, I can hear that you are, very upset or very frustrated. So in order to be able to do this effectively, I think it's important for us to understand about emotions. Because again, in medical training and nursing training and healthcare workers training, by and large, very few of us get taught about emotions. And if I was able to ask you this question in a room, and if I was, whether or not you thought they were simple or complicated, you would probably tell me they're complicated. But actually, they're very simple. There's only a few basic emotions that we can feel, although there's lots and lots of words in the various languages that we speak that expresses an emotion, which I think makes us think that there's more than there is. And this is international across the world. Paul Ekman, who is a Canadian psychologist, is probably the most famous person associated with this. And he has been acknowledged by a Pixar movie that some of you may have watched, which are all about the basic emotions. So let's just take a quick look at this little clip here.
Last subject, then homework is done. Gross. Biology?
Invertebrates are nature's... Invertebrates...
It's that slow spinny thing again.
Joey, make it go faster!
Any second now, it's just thinking.
I'll speed things up!
Nice one, Anger.
Broadband makes me sad.
We're gonna be here all night!
Hey, guys, this is really unacceptable. Guys, maybe that could help.
What? You think the answer is gonna fall from the sky?
No, not that. That!
Demand more joy from your broadband. Switch to super.
So that's an ad that appears in our television, which I use to show all the different emotions. So here they are. This is what you saw in that little clip. You saw happiness or joy, and that always means that we have something of value. And size doesn't matter here. You can be very happy because you just had a lovely cup of tea, or very happy because you just got a raise in your salary. There's no connection here with the size of, or the what would you say, this sort of the objective extent of something and what it makes us feel. Sadness always means that we're feeling loss. Surprise, which actually isn't in the movie, always means something unexpected is happening. And obviously in healthcare, you see a lot of shock, which is negative surprise. Anger always means that we're blocked from getting something. And again, you see this, I'm sure, in your families and in your patients that you look after. Fear, also sometimes called anxious, you saw that in the little clip with the doctor, always means that somebody is anticipating something really bad in the future. And disgust is an interesting emotion because it's not often talked about. And this really is happening because your values and your rules are being violated. And what's interesting about emotions is that they can blend. And here's a poster that is used in schools now, showing how emotions can blend and can have all these different names. And I'm sure in languages in India, you probably are even better names and words to describe the combination of emotions than English does. And this just gives you an example of how many English words there are to express all the different kinds of emotions. And I think this is probably why we think it's so complicated. But we can reduce it all down to the basic emotions, and then that helps us understand the impact of something on our patients and on families. And emotions will trigger people to behave in different ways unless they intervene and control the emotion. So when we're angry, we feel like having a fight. When we're feeling disgust, we feel like rejecting somebody or something. When we're feeling fear or anxiety, that'll make us avoid something. If we're feeling very sad, that just makes us give up. Surprise makes us pay attention. And happiness makes us feel very creative and makes us feel like exploring. And this is why a lot of the huge, big technology companies around the world spend so much money creating happy work environments, because it triggers much better creativity and the motivation to explore. So using empathy then involves sentences like this. I can see this is so difficult for you. I can see this is so frustrating. And if you're not sure of the exact emotion, because sometimes that can be difficult, in English, words like very difficult, I can see you're upset is a good one. Frustrating, we find, is a good one. So it's about figuring out the words that are acceptable for your patients and families so that they know that you can see. And it really does work so well. So let's go back to our Inside Out movie by Pixar, which I highly recommend, suitable for adults and children alike. And we'll see how they show how empathy works. So this is a scene from a part of the movie where this is the first one, where the two emotions, sadness and joy, are lost. They're bringing some memories back to headquarters, and they meet the little girl, Riley. So it's all about a little girl. They meet her pretend friend, Bing Bong, and he's having his own little crisis. But they need him to show them the way back to headquarters. So let's see what happens.
No, you can't take my rocket to the North! Riley and I are going to the moon! Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster.
Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time, we had breakfast twice that day.
Sadness!
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
How did you do that?
I don't know. He was sad, so I listened to what...
Hey! There's the train!
So there you go. You can see there, Joy learned a little lesson there about the value of demonstrating empathy. And this, or sorry, I can get to the slide, but before I was going to show you this. It's often called in communication world the elephant in the room, which refers to the fact that oftentimes it isn't the emotion that the person is feeling is just not said out loud. And that's really what we need to be doing as effective communicators. So when it comes to the really difficult conversations, you might want to ask me, well, like, what are the skills for those? And in fact, they are the exact same as I have outlined here. And as we all know, if we have to do something that's really difficult, so here on the left here, the skier going down the steep mountain, or the golfer here trying to get out of the very high bunker, we have to use all our basic skills with greater emphasis. So the skier knows they lean really hard into the mountain. The golfer knows they dig into the sand. They do everything they've been taught, but they do it with greater emphasis. And similarly, when we are having these really difficult conversations, we use all these basic skills that we've just gone through and just outlined and summarized with greater emphasis. So we spend longer on the introductions. We spend longer on the starting point. We make sure we do not interrupt. We use empathy and we apologize for what's happening. We are very careful with our use of open and closed questions. We screen to make sure we've covered all the concerns. We signpost and give a warning shot. We do not forget our nonverbal skills. We use simple language. We make sure we summarize, and we make sure we use teach back and safety netting so that there's no misunderstanding. This is the organization that I belong to, the International Association for Communication in Healthcare. I urge you all to check it out if you have an interest. We would welcome your membership with us. We're delighted that we actually have our new chair of our advisory committee is Dr. Shista Basu, who is in Delhi. And I've met her quite a few times and I'm working with her at the moment. And these are two books that I just think really say it all. This one here on the left is Skills for Communicating with Patients. This is all the Calgary, Cambridge that I've based today's skills on. And the one on the right is called Compassionomics, which is written by an intensive care anesthetist from the US. And it is a really good read about how communication can bring better outcomes, lower health costs, reduce burnout, so many benefits. And it's a really good book and easy to read. And that is me done. That is my final slide. And that's my email if anybody wants to contact me, and my our tag there at Human Factors PS. And there's a QR code if you want to investigate our academic diploma anymore. So thank you very much.
Thank you, Professor Eva. That was an excellent presentation. I think in 35 minutes, you touched on all possible topics that could be discussed with the audience. I'm sure it must have been a great learning for the audience. I would invite people to ask questions. They can write their questions in the chat box. I'm sure Professor Eva will be happy to help us with the answers. Yeah. So please feel free to, I think there are a couple of questions I can see in the chat box. Oh my goodness. So I think I'll start with the last one, the latest one, then I'll go up. There's a question from Mr. Vijay Shankar, and he says, how to deal with patients who are bargaining?
Yes. And I'm sure, thank you, that's a great question. And I'm sure you know that patients who are bargaining, they are kind of in the middle of their acceptance process. And so they're, if you like, they're kind of halfway there in accepting the reality, but they're not fully there. And I think, that would be what needs to be acknowledged to them. And that would be, that would be empathizing with them. And I would say something to them, look, I can hear that, this is really, really hard for you to accept. It's really difficult. And, you take your time. It's important to take your time and to go at the pace that works for you. We do know in the work that's been done for patients who are having trouble with accepting the reality that, somewhere between 10 and 20% never fully accept. But there's a concept known as the denier compliers. They do everything that they're supposed to do, but they never accept, the reality out loud. And that's okay. People have to go they have to go at the pace that's right for them. So I would be saying it out loud. I mean, I think that's the elephant in the room. Really. Yeah.
Thank you. I think, Professor Eva, that was a very wonderful explanation. I completely agree with you. Accepting a disease condition, and especially if it has poor prognosis or the recovery is not possible, it really impacts anybody's psyche very badly, and it becomes difficult to accept. And denial, as you said, is a very common reaction we all have to any disease condition. I'm not sure if Mr. Vijay Shankar was asking about the bargaining about the health condition, or it was about the bill involved. I don't know. I think he can he can explain better. But then I think you have very rightly pointed to the psychological reaction to any disease condition where
Oh,
the patient.
treatment rates.
Yeah,
He's saying it there. Yeah,
yeah,
yeah. So, I
treatment.
mean, yeah, I mean, I again, do you know what? If I was in that situation, I would be going for the emotion behind it. If they're being awkward and difficult, I would be saying something like, I'm wondering why this is difficult for you. I'm sensing, that this is very frustrating. And this is why you're not happy with what it's costing. Can you tell me more? I'd be going for the emotional side of it and see if you can find out what's really going on. And if they have genuine financial constraints, and if you feel that you really can't look after them for, less payment, well, then it's about negotiating them going somewhere else, probably.
So, if I may add to the point that Professor Eva, you are mentioning that we really need to understand what is the emotion behind it. I'm sure clarity of communication plays a very big role. So, if our rates and our payments are very clearly mentioned right in the beginning of the treatment, and also as and when the patient party wants to know more about the expenditure, I think that will prepare them better for the final bill that they will have to pay. And of course, we need to be considerate, especially if they are not in position to pay, or if they're economically not that well off. Of course, arranging some kind of way out so that their treatment does not suffer, but then you don't have to at the end bargain with them. I think clarity of communication right from the beginning plays a very big role, so that
Yeah, of
later they don't put us in. Yeah. There are a couple of more questions. If you permit, I may take them.
course.
Yeah, there's another one, and that says, how can we sense what the patient and the relatives have understood when we explain different treatment options or medicines? I think that's a good
So,
question.
yeah, so that's where the teach back method
Yes.
comes from, or will address. So it's very important when you get to the end of your explanation that you summarize it once more. And then you say to the patient or the family, and you're going to have to decide which is the best way to do this. But you're going to, you can say something like, look, I want to be sure that I have explained this properly. Can you tell me back what you understand about all the different options? Or if that doesn't feel like the right way to say it, another way that can be really effective is you might say to the patient, well, look, you're going to be going home now to your family to tell them about what we've talked about. What are you going to tell them? How are you going to explain what the options are? And that way you can get an idea of how they've understood it.
I think allowing them to explain what they have understood gives us a fair idea about what they have really, gathered, and then that gives a good check-in. Thank you for answering them. There's another question by Megha, and she asks, how can we calm the patient and the attendant if they are too much in angerness? Like if they're very aggressive or angry, then how do we
Yeah.
really calm them down?
Yes, so I think this is very important because I really think that healthcare professionals should not have to absorb a lot of anger and hostility and say nothing. I just think that's really harmful. So the way that you take control of that is with your empathy skills. So if somebody is shouting at you, it's a little bit like, the way we might manage a tantrum, in our children in a kind of a way, even though I'm not saying that these people are like children at all, but is you just kind of gauge a word that is just a little bit lower than the full strength of what the person is saying to you. So if somebody is shouting at you, I would say something like, look, I can see you are really annoyed about this. I can see, you're really frustrated. This is really, really difficult. Can you tell me more about this? And you focus on the emotion and you use a word that will bring the person down a bit. But if you don't do that, it'll get out of control.
Absolutely. I think that's a wonderful explanation, Professor Eva. Validating their emotion, acknowledging their emotion, identifying their emotion, that really helps them also to see that, yes, somebody can read my emotion. And I think at the same time, instead of reacting, if we take a pause and respond, I think we also would be in a better position to handle their anger, because we have to simultaneously handle our emotions and their emotion, and also think how do I answer their situation. And I think at that place, assertion plays a very big role, because we become, either aggressive or passive aggressive, and that comes on our face. Like you said, body language plays a very big role. Our tone of voice changes, expression changes. They can make out that we are getting agitated and we are about to lose our composure. But if we practice assertion, which is a difficult skill, I completely agree, but if we start practicing that, I think we are able to have a better control on our emotions. If you agree
Yeah.
to that.
And like a tip for being assertive is and this is obviously I'm saying it in English, but is to start your sentence with I. I think, I'm concerned, I'm noticing, something like that. If we start our sentence, in the first person like that, we are less likely to come across as aggressive. Whereas if we say to somebody, you need to calm down, now we're being aggressive. And they're not going to be able to do that. They can't, people can't shut their emotions on and off that easily. And if we feel ourselves getting really angry, I think we need to take time out. I think we need to say, look, can I call you back in a minute? I just need to go and do something. I'll be back in a second. We need to take ourselves out of that situation, calm down, and then come back.
Thank you so much, Professor Eva. There are lots of questions I can see in the chat box, but incidentally, we have a next webinar and I really do not know how to stop these questions, because there are a lot of and very
So we
relevant
will
questions.
be taking these questions. Indu, I'm sure what we'll do is we'll be in touch with both Eva and you, and all those questions can be definitely taken up, because I think this is the topic which is going to evolve a lot of discussions. And I don't think that, and some of these questions, like, if a person is not ready to pay the bill after, and especially after a poor outcome, I mean, these are extremely,
Very well.
extremely complex situations. And you'll have to probably need to have a brainstorming about it. But I think what you already said, that making some kind of a clarity about the financial issues well in advance, judging the person's ability to pay also on an ongoing basis, a lot of those things can be done. So I'm sure those questions we'll be taking.
Absolutely. I think we have actually brought up a topic which is very relevant for everybody's, concern, and it requires a lot of deeper understanding of how do you really prevent such situation, and in case if situation happens, how do you de-escalate and manage this situation. We can have a number of sessions after this on the same topic by Professor Eva and other experts, so that we can help our participants with this learning. So, Professor Eva, it has been wonderful listening to you, and you have really covered all 3, 4 aspects that you intended to do right in the beginning, and especially the part where you talked about the emotions, identifying emotion, and using that clip, on Inside, where you said how empathy can be actually expressed in such a wonderful way. I think that video was absolutely amazing.
Super.
I'm sure people will. I would really recommend everyone to, watch that movie. It's a beautiful movie, worth watching. Thank you once again, Professor Eva. Over
You're
to
very,
you.
very welcome.
So,
Delighted.
so just stay back. We are going to give you an certificate of accommodation, and Shweta, you have raised your hand. You're wanting to say something. Shweta?
Yes, thank you, sir, and thank you, Professor Eva. It was wonderful. I didn't wanted to stop this conversation which you were taking us through. This was a journey. Actually, we were really enjoying it, and we would love to have some more. So, just one suggestion: if we can have some roundtable discussions with the hospitals, and there can, we can call out various challenges in the communications, various communications. That
Yeah.
can be just an idea which I wanted to just table it out. So if we can have more
We'll do it.
roundtable conversations with Professor Eva and Dr. Indu, and
Yeah.
would love to be part of that. So
I'm
there's
sure I had been associated, Eva, with your organization in the past, somewhere in the middle. I think I got more involved in CAHO, this thing. So, this thing. So, Dr. Basu is also very well known to us and a very good friend of ours. So, I'll
Great.
be in touch with you through that.
Great.
So,
thank you.
so Prakash, can you
Yes, sir.
hand over, can show our certificate of appreciation? Are you there, Prakash? Yeah. Yes. So we are very honored today to have you, Professor Eva Doherty, and your contribution as a speaker. It will go very, very far. This is a very important topic. So thank you very much. And we are very honored to, this will be, of course, mailed to you. Please kindly accept most humbly. Thank you. Next
Thank you
few
so much.
slides, Eva, you're most welcome to just stay back. And we are wanting to announce that the 51st webinar, I'm extremely happy that it is now more than 4 years uninterrupted CAHO-ISQua webinar, and that is on patient safety incidents, reporting, learning, and developing a safety culture. Again, I think an extremely important topic. Friends, do not miss it. It is by Dr. Ilham Ochi, Technical Director of the Africa Institute of Healthcare Quality, Safety, and Accreditation. So please kind of block the next first Tuesday of the month of March. Next slide. So the ISQua Fellowship, as you know, is now which is for the Southeast Asia, and the discount is available to the CAHO members, as well as that to maintain the fellowship. If you attend CAHO-Con, that is taken good enough for you to maintain your fellowship. So do register for CAHO-Con, which is on 11th, 12th, and 13th of April. Slide will come next again also. Next slide. So the CAHO monthly quality meeting, as we do now for every first Tuesday of the month, like this meeting today with Madam Evarta, was also attended by many institutions are now broadcasting this particular meeting. And we are extremely proud that this culture of a monthly quality meeting has caught on. And today we are, can we go on? Yes. So the Vijaya Medical Educational Trust in Chennai, Mehta Hospital, Chennai, Ganga Hospital in Coimbatore, Medica in Kolkata, Fortis in Punjab, Rajagiri in Kerala, Baby Memorial, Kerala, Bethany Hospital in Shillong, Sriranga Hospital, Chengalpattu, Tamil Nadu, AJ Hospital, Mangalore, Bombay Hospital, Mumbai, Nirmal Sai Hospital, Tamil Nadu, Jabalpur Hospital, MP, Christian Medical College, Vellore, Kaveri Hospital, Tamil Nadu, Institute of Neurosciences, Calcutta. We have more that Ruby Hall Clinic, Maharashtra, Esther Medicity, Kochi, CMC Ranipat Campus, Nazareth Hospital, Shillong, AIG Hospital, Hyderabad, KG Hospital, Coimbatore, Esther Hospital, Whitefield, Esther MIMS Hospital, Bombay Hospital, Indore, and Christian Medical College, Ludhiana. So as you can see that now these centers, this meeting, the quality meetings on every first Tuesday are happening across the country, and hundreds of, almost like more than 1,000 people are able to join through those those meetings. Congratulations to these hospitals, and I'm sure that many more will join. Now, some of the upcoming activities and events, we can say that we have the quality implementation in hospitals, a basic program that is what we call as a CPQIH basic, which is on 15th and 16th of February in virtual. And they have a National Building Code of India, which is on fire, life safety for healthcare occupancies on 16th of February. We have the masterclass series of the migration of MABH from 5th to the 6th edition. And this is starting from 1st of March, every Wednesday and Saturday from 4 to 5 p.m. Friends, please do not miss to register for this. All the details have been given, are available to you both on our website as well as in the Friday update. So each masterclass session is just about 500 rupees, or if you want to take the full masterclass series, it's only about 4,000 rupees, equivalent to $50 US. Next. So we also have an awareness program on ISO 15189-2022, and the program schedule is at Trichy, SRM Medical College, Trichy. It is on 21st and 22nd of March. And this will be to learn about ISO 15189-2022, an implementation of laboratory quality management system. Yeah. The next is the CAHO National Certifying Examination for Infection Control Professionals, and the next batch, the registration is going on. The examination date is 15th of February, please. Next. Now, CAHO-Con special awards are there. That is the Environmental Sustainability Award that we are going to give in CAHO-Con, which I said is on the 12th and 13th of April. And there is a Fire and Life Safety Excellence Award for hospitals. We are wanting the hospitals to showcase what fire and life safety things they have done in their hospitals. They can showcase and win an award and can motivate other hospitals to emulate their environmental and sustainability practices or the fire and life safety practice. Next. Then again, to celebrate excellence, then you can aspire to be the next Young Quality Achiever Award. This is a very, very prestigious award being given by CAHO, which is for, people who are less than 45 years of age and have made an impact on quality promotion. And next is the Quality Champion Award, which is for people for more than 45 years of age and have made an impact on the delivery of quality. Next. Then we have, in CAHO-Con again, we have an award for the best clinical audit and also the best research publication in quality. Next. We have a video, friends, we have huge number of these contests that I'm reading out to you. Please go through our website also. And so we have a video presentation contest, as well as we have a paper and poster presentation contest. The paper and poster is one of the very, very hugely popular, of course, way of people to participate. This thing, hundreds of institutions come forward. And of course, just 4 days to go for our national conference of the diagnosticians, and which is at Hotel Eros in New Delhi. It is on 8th and 9th of February. So do block your dates. In fact, make it a point to please come. Next. And of course, CAHO-Con is now the registration, delegate registration is open, and it is on 11th. We have a huge number of pre-conference workshops spread across the whole national capital region. And 12th and 13th, we have the main conference in Delhi. So these are the social media handles that we'll want you to be associated. And also, we have now our monthly digital magazine, The Spark. Do we have a slide for that? What's the next? So there is a monthly magazine now, The Spark, which we will be sending out. Please Prakash make it a point that it goes to all the participants of this webinar today. And we, of course, invite you to join CAHO. Friends, CAHO is not an organization, it is a movement. It is a movement to help you go beyond accreditation to develop a culture of safety and to make an impact on reducing medical errors. So thank you very much. It has been a pleasure, Madam Eva Doherty, and I'll be also in touch with you. I intend coming to Ireland and we'll see you. Thank you so much. Thank you, Indu, again, especially for moderating this session. You are our rock star and backbone for spreading communication. So thank you so much. So this
Thank
is
you
a
so
brief. Yeah, thank you.
A new dawn, a new horizon of healthcare delivery and patient safety. We have a goal, a noble drive. Hand in hand, step by step, we will thrive. To march ahead together for a bright and shiny future with patient safety and quality healthcare. We are CAHO, your healthcare companion. Standing right by your side. Joining hands for building a vision, shaping a culture for patient safety. Setting up standards with best foot forward. Won't ever leave no stone unturned. We wear our pride on our sleeves. Work with passion like a breeze. Training people, enhancing their skills. Spreading the message of quality healthcare for safer patient care. A better nation.